Massage Therapy Exam Study 1467 questions. Question 1. A client's emotional state and the stress he or she feels play an important role in overall health. Feelings such as anger, depression, and sadness affect the body's physiologic processes in many ways and make an individual more susceptible to disease. Dr. Hans Selye, a leading authority on stress, defines stress as the non-specific response of the body to any demand. All things require a certain amount of stress to function efficiently. It is when stress goes beyond elastic limits that it becomes strain, or the structural loss of integrity. Dr. Selye concludes that most diseases increased susceptibility to viral infections. A. Emotional reactions. B. Emotional state and stress. C. Osteocytes. D. Postural recommendations. Question 1 Answer, B. Emotional state and stress. Question 2. Individual bone cells. A. Oto. B. Osteocytes. C. Osteoma. D. Tonicity. Question 2 Answer, B. Osteocytes. Question 3. Herniation in the umbilical region, usually owing to a congenital deformity. A. Blood serum. B. Pernicious anemia. C. Uterine fibroid. D. Umbilical hernia. Question 3 Answer, D. Umbilical hernia. Question 4. Cell fragments without nuclei that assist in blood clotting have a lifespan of approximately 8 to 10 days. A. Hepatitis C. B. Mortality rate. C. Thrombocytes, platelets. D. Muscle twitch. Question 4 Answer, C. Thrombocytes, platelets. Question 5. Tissue that lines body surfaces and cavities. A. Epithelial tissue. B. Epiphyseal plate. C. Tissue. D. Epinephrine. Question 5 Answer, A. Epithelial tissue. Question 6. The cutting off of a projecting part, for example, limb, breast. Contraindication/indication, use caution around broken skin. Deportment and other tissue manipulation can increase circulation and reduce scar tissue. A. Amputation. B. Anemia. C. D. Melanin. Question 6 Answer, A. Amputation. Question 7. The benefits of touch and its effect on emotions are generally physiologic in nature but can have an energetic effect as well. Most of the effects of massage on hormones, neurotransmitters, and various systems, for example, the nervous, circulatory, immune systems, can result in physical as well as mental and emotional changes. The connection between the physical and the emotional can be observed in the fight or flight mechanism of the sympathetic and parasympathetic nervous systems, which is based on an emotional reaction of perceived threat or stress and causes emotional as well as physical responses. A. Emotional reactions. B. Protraction. C. Exhalation. D. Initial phase. Question 7 Answer, A. Emotional reactions. Question 8. Conditions used to treat digestive system problems. A. Pharynx. B. C. Hepatitis C. D. Peppermint. Question 8 Answer, D. Peppermint. Question 9. Secrete serous fluid, a lubricant, cover the internal organs in the thoracic, abdominal, and pelvic cavities. A. Teres minor. B. Posterior, dorsal. C. Blood vessels. D. Serous membranes, serosa. Question 9 Answer, D. Serous membranes, serosa. Question 10. Muscle pain. A. Myalgia. B. Cyano. C. Anixia. D. Sclera. Question 10 Answer. A. Myalgia. Question 11, meaning both, example ambidextrous. A. Renin. B. Con. C. Dis. D. Ambi. Question 11 Answer. D. Ambi. Question 12, a network of interconnecting nerves. A. Nerve plexus. B. Tubercle. C. Anconus. D. Gracilis. Question 12 Answer. A. Nerve plexus. Question 13, Body Substance Isolation, BSI, is a set of guidelines that provides a consistent approach to managing body substances from all patients and is essential to preventing spread of infection. The infection precautions used in BSI place a physical barrier between the caregiver and the potentially infectious agents. Consistent barrier precautions should be used whenever a caregiver might come into contact with a client's broken skin or moist body substances, for example, blood, pus, feces, urine, saliva. Some of the precautionary measures recommended for massage therapists in clinic and hospital settings include wearing gloves, gowns, and/or masks and performing proper hygiene. A. Tobacco, nicotine. B. Tibialis anterior. C. Body substance isolation. D. Amputation. Question 13 Answer. C. Body substance isolation. Question 14, meaning big, example splenomegaly. A. Mega. B. Heart. C. Odo. D. Adeno. Question 14 Answer. A. Mega. Question 15, shock caused by bacterial infection, results in localized vasodilation and increased blood vessel permeability, and thus decreased blood pressure. A. Septic shock. B. Spine. C. Tetanus. D. Retina. Question 15 Answer. A. Septic shock. Question 16, these are mostly related to meridian concepts in Oriental medicine, in which the 14 basic meridians flow in a pattern. The practitioner can palpate the meridians at specific acupuncture points or perform pulse reading, which can be an assessment of the meridian flow at the wrists, where all basic meridians can be accessed. A. Energy channel blockages, Asian. B. Organ of Corti. C. Degenerative disc disease. D. Connective tissue. Question 16 Answer. A. Energy channel blockages, Asian. Question 17, acts as the pacemaker of the heart, situated in the posterior wall of the right atrium. A. Parotid glands. B. Pineal gland. C. Occipital lobe. D. Synovial node. Question 17 Answer. D. Synovial node. Question 18, drugs used to reduce vasoconstriction, thereby allowing blood pressure to lower. Common drugs in this group include enalapril, Vasotec, Rimipril, Altas, and benazpril hydrochloride, low tensin. A. ACE inhibitors. B. Nephritis. C. Large intestine. D. Peritonitis. Question 18 Answer. A. ACE inhibitors. Question 19, position, proximal to the wrist, origin, distal anterior ulna, insertion, distal anterior radius, action, forearm pronation. A. Mitochondria. B. Pericardium. C. Pancreas. D. Pronator quadratus. Question 19 Answer. D. Pronator quadratus. Question 20. Softening and deterioration of the articular cartilage on the posterior patella, pain usually experienced when forcefully extending the knee. Causes: instability of the knee, substantial misalignment of the patella on the femur, overuse, chronic subluxation of the patella. Contraindication/indication: obtain advice and approval of client's doctor before performing bodywork because of potential damage, particularly in acute cases. Massage to and stretching of the quadriceps would be beneficial and could relieve the pain. A. Craniosacral pulses. B. Salicylates. C. Chandramalasa patelli. D. Pharmacodynamics. Question 20. Answer: C. Chandramalasa patelli. Question 21. Conditions used to treat decreased energy. A. Tendon. B. Mixture. C. Hydeo. D. Ginseng. Question 21. Answer: D. Ginseng. Question 22. The heart chakra represents growth, love, and balance between body, mind, and spirit. It is the seat for compassion and love and can manifest pressure when a lack of love and compassion is present in the form of immune system or heart problems. A. Iatric. B. Homo. C. Chakra 4. D. Organ. Question 22. Answer: C. Chakra 4. Question 23. Meaning same. Example: homosexual. A. Herbs. B. Atom. C. Homo. D. Lipo. Question 23. Answer: C. Homo. Question 24. Patches of lymphoid tissue that contain high amounts of phagocytes and produce lymphocytes usually occur in clusters and carry the name of the region of the body in which they are found. A. Gonads. B. Lymph nodes. C. Amputation. D. Penis. Question 24. Answer: B. Lymph nodes. Question 25. Pain in the chest caused by reduced coronary circulation that may or may not be the result of heart or arterial disorders, myocardial infarction, hypertensive heart disease, or any of the chronic ischemic heart diseases. Contraindication/indication: massage should be light and soothing, avoid endangerment areas, and abdominal massage may cause increased pressure on the heart. The client is best positioned supine with a cushion under the right hip to avoid pressure on the inferior vena cava. Massage can overwork the heart, so obtain the approval of the client's doctor before performing bodywork. A. Long bones. B. Angina pectoris. C. Protons. D. Subscapularies. Question 25. Answer: B. Angina pectoris. Question 26. A hormone produced by the alpha cells increases blood sugar levels by various means, for example, releasing glucose from glycogen stores in the liver. A. Glucagon. B. Actin. C. Viscero. D. Gonads. Question 26. Answer: A. Glucagon. Question 27. The study of the normal functioning of the body. A. Physiology. B. Signs. C. Catabolism. D. Glycogen. Question 27. Answer: A. Physiology. Question 28. Meaning blue. Example: cyanosis. A. Cyano. B. Genes. C. Kidneys. D. Sclera. Question 28. Answer: A. Cyano. Question 29. Bending the trunk or neck laterally, also called side bending. A. Renal pelvis. B. Lacteals. C. Lateral flexion. D. Retraction. Question 29 Answer, C. Lateral flexion. Question 30. A non-acute bruise that cause hemorrhage below the intact skin. Contraindication/indication, watch for bleeding and avoid the area of the bruise. Energy work can promote healing. Do not massage directly on the bruise until clotting has been reabsorbed and the color of the bruise changes. A. Pronation. B. Elevation. C. Contusion. D. Myosin. Question 30 Answer, C. Contusion. Question 31. Prothrombin is converted into thrombin, fibrinogen is converted into fibrin, a thread-like protein, and fibrin threads form the clot. A. Exhalation. B. Blood vessels. C. Blood clot formation. D. Isotonic contraction. Question 31 Answer, C. Blood clot formation. Question 32. An increase in muscle cell size. A. Hypertrophy. B. Osteoma. C. Steno. D. Heart rate. Question 32 Answer, A. Hypertrophy. Question 33. The most important interview technique is listening. Communication can come in subtle ways, so pay attention to details, such as voice intonation and pauses. A. Listen. B. Antigen. C. Sour. D. Blister. Question 33 Answer, A. Listen. Question 34. Remember that the main source of strength comes from the lower body, not the arms and shoulders. Balance on both feet with the knees bent. Keep the back straight and head up. Use the pelvis and torso to provide the leverage and strength needed to apply pressure. Elbows and hands should stay close to the body. Shoulders and wrists should stay relaxed. Use substitutes, for example, elbows, forearms, fists, when more pressure or relief is needed. Keep wrist and hands in alignment with the movement. Avoid small, repetitive movements. If injury or excessive stress occurs, rest until it heals. Adjust the table height to allow for proper posture in relation to your height and your client's body size. A. Postural recommendations. B. Narcotics. C. Osteoblasts. D. Protraction. Question 34 Answer, A. Postural recommendations. Question 35. Serous membranes associated with the lungs produce a lubricant to reduce friction between the lungs and the walls of the pleural cavity. A. Synovial membranes. B. Pleural membranes. C. Irregular bones. D. Recruitment. Question 35 Answer, B. Pleural membranes. Question 36. Nearsightedness. Cause, elongation of the eyeball, causing the image to focus too far forward, before it reaches the retina. Contraindication/indication, none. A. HEPA. B. Asepsis. C. Dry. D. Myopia. Question 36 Answer, D. Myopia. Question 37. Arises from nerve root cell 1 through S4, provides sensory and motor innervation for the lower extremities, gives to the obturator nerve, femoral nerve, and sciatic nerve. A. Brachial plexus. B. Memory cells. C. Lumbosacral plexus. D. Nucleus. Question 37 Answer, C. Lumbosacral plexus. Question 38. The inner layer of the heart, composed of epithelial and connective tissues. A. Midbrain. B. Tendon. C. Cervix. D. Endocardium. Question 38 Answer, D. Endocardium. Question 39. Produces antidiuretic hormones and oxytocin. A. Sternocleidomastoid. B. Inferior to the ear. C. Pericardium. D. Posterior pituitary. Question 39. Answer: D. Posterior pituitary. Question 40. Prepares the body for rest, also called the rest and digest system. A. Parasympathetic nervous system. B. Conception vessel. C. Inflammation, acute. D. Arteriosclerosis. Question 40. Answer: A. Parasympathetic nervous system. Question 41. Conducts the action potential to the effector organ to elicit a response. A. Efferent, motor, neuron. B. Uterus, womb. C. Renal medulla. D. Testosterone. Question 41. Answer: A. Efferent, motor, neuron. Question 42. The most rigid connective tissue, provides structure and protection. A. Kidneys' specific functions include: B. Blood transfusion. C. Hard connective tissue includes bone. D. Assessment, strength, con. Question 42. Answer: C. Hard connective tissue includes bone. Question 43. In today's society, mental illness is on the rise. It is estimated that at least 10% of the general population experiences some kind of disability from a mental illness. Therefore, massage therapists need an understanding and familiarity with common mental health conditions that enable them to know when to involve a mental health professional. This chapter provides a brief review of the common symptoms of the most significant mental disorders to help you determine when to refer a client back to his or her physician for follow-up. A. Epithelial tissue. B. Thoracic outlet syndrome. C. Psychological and emotional disorders. D. Post-traumatic stress disorder. Question 43. Answer: C. Psychological and emotional disorders. Question 44. A condition in which the placenta is attached to the uterine lining in the lower portion of the uterus, can cause abruption placentae and necessitate a cesarean section to spare the mother's or baby's life. A. Plantaurese. B. Ischemia. C. Platysma. D. Placenta previa. Question 44. Answer: D. Placenta previa. Question 45. 1. Transports gases, for example, oxygen, carbon dioxide, nutrients, building blocks, to the tissues, waste products from the tissues, and hormones. 2. Regulates the pH of the body, the amount of fluids in the tissues, by maintaining a proper osmotic pressure and body temperature. 3. Protects against pathogens and blood loss. A. Descending limb. B. Constipation. C. Ankiness. D. Functions of blood. Question 45. Answer: D. Functions of blood. Question 46. The third eye chakra, associated with the pineal gland, represents intuition, imagination, clairvoyance, psychic ability, and higher comprehension. A. Fossa. B. History. C. Chakra 6. D. Warts. Question 46. Answer: C. Chakra 6. Question 47. The second largest structure of the brain, found posterior and inferior to the cerebrum, also divided into hemispheres. A. Cerebellum. B. Periostem. C. Areola. D. Peri. Question 47. Answer: A. Cerebellum. Question 48. Meaning against, example antibiotic. A. Der. B. Cilia. C. Chi. D. Anti. Question 48. Answer, D. Anti. Question 49. Meaning surgical removal. Example appendectomy. A. Aerobe. B. Tendon. C. Motor. D. Ectomy. Question 49. Answer, D. Ectomy. Question 50. Begins, inferior to the clavicle, location and direction, from the chest, up the arm to the thumb, ends, nail on the radial side of the thumb, points, 11, yin or yang, yin, element, metal, emotion, grief, worry. A. Lung. B. Burns. C. Rugi. D. Odo. Question 50. Answer, A. Lung.